2025, the United States is grappling with a crisis that has devastated communities across the nation: the fentanyl epidemic. It is often called the deadliest drug crisis in American history, with a wave of destruction that has left tens of thousands dead, families shattered, and neighborhoods struggling to survive. Fentanyl is not just another drug, it's a synthetic opioid so powerful and dangerous that it has earned the nickname the silent killer. For many, it has transformed them into American zombies. People trapped in addiction, unable to escape the grip of this relentless poison. Fentanyl was originally developed in the 1960s as a powerful painkiller for medical use, intended for patients suffering extreme pain from surgery or cancer. While its legitimate medical use remains vital, it is the illegal production and trafficking of fentanyl that have created a nightmare. This synthetic opioid is estimated to be about 50 to 100 times stronger than morphine and about 50 times stronger than heroin. That potency means even a tiny amount can cause an overdose and death within minutes. The drug's lethal potential is so high that just a few milligrams, roughly the size of a grain of salt, can be fatal. In recent years, illicit fentanyl has flooded the streets of America, often disguised in counterfeit pills or mixed into other drugs like heroin, cocaine, and methamphetamine. This mixing is particularly deadly because users often don't know they are taking fentanyl. They believe they are buying cocaine or prescription opioids, but instead, they get a lethal dose of fentanyl. The result is a skyrocketing number of accidental overdoses. The statistics are grim. In 2023, the United States recorded over 1 in 5,000 drug overdose deaths, and fentanyl was involved in more than 70% of those cases. The crisis has hit every demographic, affecting urban and rural areas alike, and spares no age group. Young adults, middle-aged individuals, and even teenagers have fallen victim. Families across the country are mourning loved ones who were taken too soon. Entire communities have been left to pick up the pieces after waves of overdose deaths ravage their neighborhoods. The impact of fentanyl goes far beyond the death toll. The epidemic has overwhelmed hospitals and emergency services. Emergency rooms are filled with patients suffering from overdoses, and first responders face constant pressure to save lives. Paramedics carry naloxone, an opioid overdose reversal drug, and administer it daily, often multiple times in a single shift. While naloxone saves lives, it is not a cure. Many people who survive overdoses fall back into addiction, trapped in a cycle of use and recovery that is incredibly hard to break. One of the darkest realities of the fentanyl crisis is how easily this drug has spread throughout the country. It is no longer confined to certain cities or regions. Instead, fentanyl is everywhere. In small towns, suburban neighborhoods, and big cities. The drug is cheap to produce, easy to smuggle, and devastatingly effective at hooking users. Dealers often cut fentanyl into other substances to increase profits, without regard for the deadly consequences. The origins of illicit fentanyl are international and complex. Much of the precursor chemicals needed to manufacture fentanyl are produced in China. These chemicals are then shipped to Mexico, where powerful drug cartels manufacture the synthetic opioid in clandestine labs. From Mexico, the fentanyl is smuggled across the US-Mexico border through a variety of means, hidden in vehicles, drones, or even tunnels. Despite intense efforts by law enforcement to intercept shipments, the sheer volume and creativity of traffickers make this an ongoing battle. The trafficking networks behind fentanyl are ruthless and highly organized. Cartels exploit weaknesses in border security and capitalize on demand within the United States. They distribute fentanyl through street dealers and online markets alike. The rise of the dark web has made it easier than ever for users to obtain fentanyl and other synthetic opioids anonymously, making enforcement even more difficult. The consequences for users are devastating. Fentanyl addiction is fast and severe, often progressing more quickly than with other opioids. Users can become dependent after just a few uses, and the withdrawal symptoms are intense, making quitting nearly impossible without professional help. Many people turn to fentanyl after becoming addicted to prescription opioids or heroin, only to find themselves trapped in a more dangerous cycle. The crisis has also had a profound social and economic impact. Families lose breadwinners and loved ones, leaving children orphaned and communities destabilized. Employers face lost productivity and healthcare systems are strained. The stigma surrounding addiction often prevents people from seeking help, compounding the problem. Meanwhile, the cost of addiction treatment and emergency care places a heavy burden on taxpayers and government programs. Efforts to combat the fentanyl crisis have been wide-ranging but face enormous challenges. On the law enforcement front, agencies have ramped up efforts to dismantle trafficking operations and intercept fentanyl shipments. Border patrols and customs agents use advanced technology and intelligence sharing, to catch shipments before they enter the country. However, the flow of fentanyl remains steady, and dealers adapt quickly. Public health initiatives focus on prevention, education, and treatment. Many communities have launched awareness campaigns to educate young people about the dangers of fentanyl and opioids. Schools, nonprofits, and government programs work to spread the message that even a single pill can kill. Yet changing behavior and attitudes about drugs is an uphill battle, especially in areas hardest hit by addiction. Treatment options for opioid addiction, including fentanyl, have expanded but are still insufficient. Medications like methadone and buprenorphine help reduce cravings and withdrawal symptoms and are considered the gold standard for opioid use disorder. Still, many people lack access to these treatments due to cost, availability, or stigma. Mental health services and counseling are also critical parts of recovery but often remain underfunded. Harm reduction programs such as needle exchanges and naloxone distribution save lives but are sometimes controversial. Critics argue they enable drug use, while proponents stress that these programs reduce the risk of overdose and disease transmission, buying time for users to seek treatment. Balancing these views is a persistent challenge for policymakers. The fentanyl crisis is deeply intertwined with broader social issues, including poverty, lack of opportunity, and mental health challenges. Many people who become addicted to opioids come from backgrounds marked by trauma, unemployment, or social isolation. Addressing these root causes is essential but complex. It requires coordination across healthcare, social services, education, and law enforcement. Tragically, fentanyl overdoses sometimes involve children and teens who accidentally ingest pills, mistaking them for candy or medicine. The presence of fentanyl and counterfeit pills makes this problem even more dangerous. Parents and caregivers live in constant fear, and schools have ramped up efforts to educate students about the risks. The crisis has also affected first responders and healthcare workers deeply. These professionals witness the horrors of overdose and addiction daily. Many suffer burnout, trauma, and stress as they try to save lives in an unrelenting epidemic. Their stories remind us that behind the statistics are real, people struggling on the front lines. Government response at the federal level includes funding for treatment programs, research into addiction, and support for law enforcement efforts. The declaration of the opioid crisis as a public health emergency has unlocked billions of dollars in resources. Still, critics argue that more decisive action is needed, including stronger border controls, tougher penalties for traffickers, and greater investment in prevention. Communities themselves have become critical battlegrounds in the fight against fentanyl. Grassroots organizations, faith groups, and local leaders play a vital role in outreach and support. They provide education, counseling, and safe spaces for those affected by addiction. Stories of recovery and resilience emerge from these efforts, offering hope amid despair. In 2025, the fentanyl crisis shows no sign of abating. New synthetic opioids and variations of fentanyl continue to appear on the market. As traffickers evolve their methods, public health and law enforcement must adapt quickly. The fight is a long and difficult one, requiring commitment, resources, and compassion. While policymakers debate strategies and communities struggle to respond, one truth is clear. There is no single solution to the fentanyl crisis. This epidemic is too complex for simple fixes. Expanding access to addiction treatment is critical, yet many areas lack affordable clinics, trained professionals, or resources to help people seeking recovery. Medication-assisted therapies and counseling offer proven paths to sobriety but remain out of reach for many who need them most. Prevention must also be a priority. Education campaigns in schools and communities can warn young people about the deadly risk of counterfeit pills laced with fentanyl. Meanwhile, drug dealers exploit encrypted apps and social media to sell opioids directly to users, forcing public health officials and law enforcement to adapt and counter these digital threats with new strategies. Law enforcement remains essential, especially in disrupting trafficking networks and strengthening border security to stem the flow of fentanyl from Mexico and its precursor chemicals from China. But simply arresting users or low-level dealers risks repeating the failures of past drug wars. A balanced approach recognizes addiction as a public health issue, not just a criminal one. Communities themselves are on the front lines. Grassroots groups, faith organizations, and peer support networks provide naloxone, counseling, safe spaces, and hope. Their work is vital in reducing stigma and helping people see addiction not as a moral failing, but as a treatable medical condition. Ultimately, fighting fentanyl requires addressing deeper social problems: poverty, trauma, unemployment, and lack of mental health care. Only by confronting these root causes can America hope to break the cycle of addiction and prevent more lives from being lost to this deadly drug. What is clear is that fentanyl has left a permanent scar on the American landscape. It has taken lives, destroyed families, and challenged the nation's ability to respond to a rapidly changing threat. The American zombies are not the stuff of fiction, but real people caught in the grip of addiction. They are a reflection of systemic failures, broken social safety nets, and a drug trade that operates with ruthless efficiency. If this story moved you, please like, share, and comment below. Tell us your thoughts on the fentanyl crisis and how your community is affected. Subscribe for more in-depth stories on America's most urgent issues and how we can overcome them together.